Now, you can't do anything without feet. And for a lot of Marfan patients, the feet are a major limiting factor. So I asked Mr. Toby Winkworth, a busy practicing orthotist in Kent, who commonly treats flat feet in ordinary people with exercise, arch supports, and ankle braces for ankles that are loose. Unfortunately, having helped me create this talk, due to family illness, he can't be with us today, so he asked me to present. I will do my best and take any questions I can't answer back to Toby. Right, next slide. What's an orthosis? It's a fancy name for any device used to modify the structural or functional characteristics of the neuromuscular system. So we're talking about braces and supports for hip, knee, ankle, foot, and spine. There are four principal objectives: to assist, limit, prevent, or restrict movement. The main idea is to provide stability in the ankle. In other joints, to prevent undesired contractures, but this can actually affect the toes as well. Manage pain in stretched soft tissue like the ligaments on the bottom of the foot, realign joints, and improve efficiency. The foot's function is to provide a stable platform for weight bearing, which still remains mobile. This allows for variation in ground surface and the rotation movements of the lower limb. The weight-bearing areas are the metatarsal heads, that's the base of the toe, and the back of the calcaneus, the heel. In Marfan syndrome, connective tissues such as ligaments and tendons stretch, causing both arches in the foot to flatten out. This causes the joints to be unstable and hypermobile. On the left, you see a lovely flat foot. On the right, you can see how complex a structure the foot is. It's composed of, at the top, the tibia and fibula, then the weight-bearing bone underneath that one, underneath the tibia, called the tarsus, and then the calcaneus, which is the heel bone. And after that, all the foot and toe bones. There is a nice arch on that foot. And actually, there are two arches in the foot. One is the longitudinal arch, which we all know about. And then there's another one under the heads of the toes, which is called the transverse arch. And both of those flatten in Marfan syndrome. The bottom of the foot can be very painful under the heel and on the sole. And you can see why, because the long ligaments that stretch from their attachment at the heel to the base of the toe are too stretchy, and they flatten with the weight of the body. And that stretch causes pain at the points of insertion. Transverse arch, the one under the metacarpal heads, causes a problem when they move out of alignment. And you may have one or two of the heads which actually are lower than the other heads, and they take all the stress when standing or walking, causing pain and discomfort across the forefoot. In addition, the position of the heel with the hind foot facing outwards can be associated with the flat foot. And of course, that affects the knee, the hip, and the back. The bottom diagram shows that you can correct this by putting an elevation on the inner aspect and adding it to the inner sole. And this repositions the foot and the ankle. So how do we treat flat foot? A longitudinal removable insole supports the long arch, and it can be moved from shoe to shoe. They are fairly expensive. They can cost £70 per pair, but they usually last a good 9 months. If you've got a child with flat feet, of course, every time they change shoe size, they're going to need new ones. It's important to buy shoes deep enough in the toe to accommodate both the toes and the arch support. If you've got pain across the forefoot because the transverse arch is dropped, a dome can be built into the insole. And the next slide shows you this dome. On the left, the yellow pair of insoles has a little tear-shaped area just underneath the toes, and that lifts the metacarpal heads off the floor. This first pair and the middle pair can be bought commercially, but it's much better to have one made, as on the right, for your very own foot. Next. And here you can see the mold of the foot being taken. Plaster Paris used to be used, but nowadays they use a rigid form casting box, which is quite painless and takes a very accurate mold of both feet because they may be slightly different. What about the toes? They suffer also. And contractures, calluses, corns, and bunions can result. These can be accommodated within the shoe and treated at regular intervals by the podiatrist. Also, a range of toe supports is available from the Cozy Feet company online. And here you can see on the left, an arch support for the transverse arch and additions to straighten the toe or protect it from rubbing, especially if you've got long feet. The big toe on the far right may suffer. Ankle supports can also be purchased online or from sports shops. The one on the right needs to be fitted by an orthotist. For very severe cases, referral to an orthopedic surgeon specializing in feet may be necessary. And in the left picture, you see a simple fusion, just involving two bones. But on the right, you can see that this ankle is so lax, it's having to be stabilized from all directions. And a triple arthrodesis may have to be performed, which means fusing three bones together. What about shoes? They're very hard to get. I'm sure a lot of you have had trouble if your feet are long and thin. It's important to wear flat heels with Oxford lace-up style shoe to support the arch. If the ankles are also weak, then boots with ankle support are preferable. And if you wear trousers that go down over the top of the boot, nobody needs to know that you're wearing boots. This is important. In some schools, boots are not allowed, so you have to have a word with the teacher. With children, they may have to go into adult shoes early to find the correct length. Once they're out of school, fashionable sports shoes with ankle support are probably the best shoes around, and they do come in large sizes. Those with built-in arch support are best, but if the child has an orthosis, you can take out the inner sole that comes with the boot and slip your own orthosis into the sports shoes to protect the arch, especially with weight-bearing sports like running, basketball, etc. And here are some different types of shoes. The top left is the classic Oxford with the lace-up and the protection for the arch. If you've got bunions or corns, a slightly softer shoe, like the one on the right, may be better for you. And when you're sporting, ankle support. In the summer, the lighter pair on the left, and if you're running, the one on the right is probably the best bet. What about the ladies? Well, here you can see a very fashionable boot on the left, an ordinary work shoe in the middle, a rather sporty looking boot on the right, and the bottom row for evening wear, the most you should go to really is the pump with the low heel on the left. Can anybody tell me why the middle red shoe is not a good idea? They're very fashionable and fun to wear, but just for a very short time. Also, the one on the right is not suitable because there's no support at all in the ballerina slipper. However, for short periods of time and for the sake of fashion, you can try these, but take a low heel shoe with you to the party for afterward. Where do we find large shoes? Now, this list we've shared with the Tall Club UK, and they're very friendly. They know all about Marfan syndrome. They're used to tall women and men, and they welcome new members. But this is also on our website. So Crispin's, Magnus, Otto and Ivy, Balnique, worth looking at their shoe lines online. But if you're going to actually buy them, and they cost quite a bit, I would tend to go to your nearest shop. Orthopedic shoes may be necessary. These are expensive. They can cost about £200 a pair, but as adults, you'll find that a good pair of shoes will last for years. Companies recommended: James Taylor and Kenward Orthopedic Footwear, I hear mentioned most of the time. And what you need to do is make sure the toe area is deep enough for the toes and the orthotics. So when you go shoe shopping, take your orthotics with you and slip them into the shoe and try them on in that fashion. I would highly recommend that you find a podiatrist near you. There are a lot of them about, usually on the high street. They're very, very well trained. And a good podiatrist is a friend for life, just like a good physiotherapist. Any questions at all? Any problems?
Mary has been told that the fusion of her foot and ankle is the only way to correct her flat foot. How successful is this usually, and could it worsen her back pain? How bad an operation is it? It's been described by the consultant as a very long recovery period.
How old is Mary? Any idea? Young, old, middle-aged?
Mary, do you mind divulging your age somewhere in the chat feed?
What I was going to say is that the younger the patient.
57, Mary's 57.
57. Oh, that's a good age. Lots of potential. Yes, probably unless she knows she doesn't heal well, she's probably in a pretty fair category for healing time. But I would make sure that she takes lots of supplements, vitamin supplements, before, during, and after, especially vitamin C and D3, because what you're trying to heal are the tendons and ligaments, which have a high collagen component. Now, the collagen in Marfan syndrome should be normal. It's only the fibrillin that's affected. So you're trying to enhance healing by enhancing the most important available protein. I would think it's a last attempt to stabilize a joint. And so don't make the decision lightly. But I have had one patient who was 22 who had the triple arthrodesis at Guy's Hospital with foot surgeon. And it really revolutionized her life. She hardly went out of the house beforehand. And afterwards, she was able to return to work. So if it works, it's great. And the younger you are, the better. So don't leave it too long if you're going to go for surgery. I think you have to listen to your surgeon if he talks to you about the complication rate for your particular age. And cover it with antibiotics for certain, and probably for longer than he would do in a patient who didn't have connective tissue disorder. Good luck.
Any further questions for Anne? I'm searching for raised hands.
Well, if you have any questions, please send them in and I'll ask Toby. And he apologizes.
What about treatment for metatarsalgia? The inflammation, when all of your foot's inflamed and it precludes walking?
That is really tricky. As you know, we've had one patient who had that problem for years. It's because you can't get off your feet, really. You know, no one can live their life in a chair or in a bed. Patient may have to resort, if they've tried all the things covered in this lecture, they may have to resort to steroid therapy, because sometimes that damps down the inflammation just enough to push it into recovery mode. Lose weight, try and strengthen the muscles in the foot. There are exercises you can do, such as putting the foot flat on the floor and drawing your toes inward, and trying to do the same with your arch, trying to increase the arch. So if you can increase the muscle support for the joints, then this may help to relieve the strain. Those are the only two additional suggestions I can make. There's certainly medications in order. I would start with a non-steroidal anti-inflammatory like Brufen. And then if that doesn't help, you might have to move on to steroids for a short period.
I think the patient has tried everything, largely to no avail, but
yes.
Yeah.
Well, in that case, you might have to use steroid injections. Might have to go back to somebody like Dr. Narami, who can inject steroids. And they can inject them under imaging into exactly the right place. Medication is sort of gunshot therapy. You know, you're affecting the whole body, but they can image where the pain might be coming from and slip a very fine needle in with the imaging still running and inject the steroid into the exact spot that's painful. Might well be worth an attempt.
Thank you, I'll pass that on. I think Patricia Apothecary has a question, I can see.
I'm not sure if I can remember all the details without going back to looking at this talk, which I'd like to do. But under the management of back pain, there was some concern about using support, weakening muscles and actually eventually leading to worse outcomes. What would be your view of that in relation to this particular part of the body?
First of all, I don't agree entirely with that. I think that if you can support an area, that takes the strain off the nerve endings, and that's where the pain's coming from. So I think you need both. You definitely need exercise. He's quite right. Exercise within tolerance, regular, gentle exercise is our mantra for people with Marfan syndrome. But if you've got pain and you're having to work or stand up for a long period of time, you need a back support. You know, if you've got a painful knee and you're going shopping, you need to put your knee support on. So I quite see where he's coming from, that in the long run, if you were to wear it all day, you would be keeping the muscles from contracting and therefore strengthening. But no, I always recommend joint supports. You know, wrist supports for gardening, just whatever activity you're going to undertake, slip the support on during the activity, and then when you're finished, take it off and do your exercises. So I think you need a combination. And definitely in the foot, I think, you know, ankle supports are easily bought. You need to get the ones with the cutout for the heel, or else your heel gets rubbed up. Figure 8 ankle supports are grand. And a little support underneath the metatarsal heads to restore that transverse arch.
I think Mary echoes this. She cannot bear to walk any distance without wearing orthotics and actually ends up with a sprain. So she echoes your advice, Anne.
Yes. Yes. I think a lot of the doctors give you advice for people who don't have connective tissue disorders. But they don't realize that you can't train a defective ligament. You know, it's never going to be normal. If you've got flat feet, you're always going to have flat feet. They can offer exercises for children who don't have connective tissue disorder, but they don't work in Marfan syndrome. I had one orthopedic surgeon say to a child with flat feet, go and run across rough ground. You know, I thought that would develop the muscles in the feet and the ankle. And of course, it does exactly the opposite. It gives you sprained ankle, which is even worse. So a lot of them don't understand. You may have to explain to the doctor what it is that you've got. Take one of our pamphlets along. We have a special one about joints and ligaments. That demonstrates to them that these are special problems in Marfan syndrome.
Mariam wonders as to natural remedies for pain relief.
Well, try it and see. We did a survey of 50 patients over 50. And one of the questions was, this is 50 patients with Marfan syndrome. One of the questions was, do you have pain? Yes. Where? Yes. What do you do for it? Please tell us about non-medical treatments that you have tried. And patients are very shy about telling you that they take a special herb or, you know, they do something special. So we deliberately ask them, what are these things that you use? And they've tried everything from acupuncture to ultrasound to electrical stimulation. The answer is, if it works for you, keep doing it. They're all quite harmless. But you do need, I think, to talk to a physiotherapist because they have all these techniques at their fingertips. So I would try a good physiotherapist first and see what they say.
Do we know of physios who are sort of au fait and well acquainted with Marfan syndrome? Mary wants to know.
Well, you have to go along and teach them about Marfan, and then they'll be an expert. What I've found over the years is that if you don't have an expert, you can make one. But all the patients have a role in explaining to whoever's treating them what Marfan syndrome is, because it only affects 1 in 3,000 population. So they may never have seen a patient with Marfan syndrome unless they're very lucky in their training.
And Kate finds there's a big disparity between private podiatrists and NHS orthotics. Private is just much more bespoke and precise and comfortable.
Yes, I agree. But again, educate them. You know, don't assume that they can't help just because you have Marfan syndrome. You're really not that much different from the ordinary child whose foot I showed you first. A large proportion of the population have flat feet, and that's where the podiatrists learn their skills. So they can transfer these to a specialized population, no problem. So try it and see, and if it works for you, keep doing it.